everyone, I'm Dr. Pradip Dutta, diabetologist and consultant physician at ILS Damdan Charnak and so many hospitals. I would like to interact with you all on the topics, the very hot topics, the latest update in hypertension. Systemic hypertension is the leading cause of global cardiovascular morbidity. It is a condition which can be diagnosed easily and without much cost. Uncontrolled hypertension promotes target organ damage and significant disease burden on the community. Therefore, aggressive control of hypertension is mandatory to preserve and protect public health in India. Since hypertension is a common disease in the community, the guidelines on its management are issued periodically by the expert in the field and the advocacy of professional organizations. It is estimated that nearly 1.5 billion adults in the world will have hypertension in the decade ahead. The latest European guideline retain the previous definitions of hypertension. Previous definitions mean blood pressure greater than 140/90, whereas the American guidelines lower the thresholds to define hypertension to less than 138. As per WHO, nearly 63% of total death in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affects 45% people in the 40 to 69 age groups. Raised blood pressure is among the most important risk factor for the cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension and lack of care through primary care and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women from 29% and 28% respectively. According to the WHO, despite that, nearly half of the people or 51% of the men and 41% of the women with hypertension were unaware of the conditions. Additionally, was 62% of the men and more than 53% of the women living with hypertension did not get any treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide, according to the WHO Lancet 2021 data. The International Society of Hypertension, ISH, has released the ISH 2020 Global Hypertension Practice Guideline. The inclusion of the optimal essential treatment paradigms attempt to address the issue that the resource poor settings, optimal care refer to the evidence-based standard of care, and whereas the essential standard refer to minimum standard of care to allow specification of the essential standard of care for low resource settings. The AHA and or SAC has released a scientific statement in 2021, offering new guidelines for management of stage 1 hypertension among patients with low atherosclerotic cardiovascular disease, ASCVD, risks among low risk adult, no ASCVD, or 10 years CVD risks greater than 10% with stage 1 hypertension, means blood pressure 130 to 139, systolic and diastolic 80 to 89 millimeter of mercury. Management start with a non-pharmacological therapy if blood pressure remain uncontrolled at 3 to 6 months. Consider starting pharmacological therapy. Acute respiratory distress syndrome, at the newer concept is acute respiratory distress syndromes is potentially fatal condition involving lung damage and experts often associated with severe COVID-19. A recent study which appears in the Journal of the American College of Cardiology report that metoprolol can reduce lung inflammations and improve respiratory function in people with COVID-19 induced ARDS, and lowering systolic blood pressure target down to the 110 to less than 130 millimeter of mercury range substantially reduce cardiovascular adverse event in the STEP randomized trial. Affirming the sprint finding for an older Chinese population among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of composite cardiovascular risks, finding from now a second major trial supporting a lower target could unite the guideline, which even among US professional societies ranging from the threshold of 130 to 150 millimeter of mercury. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, this is the most important. The 2018 European guidelines on the management of arterial hypertension recommended that the diagnosis of hypertension should not only depend on office BP measurement, but also on out of office measurements such as ABPM, ambulatory blood pressure monitoring, or home blood pressure monitoring. ABPMs, 24 hours and nighttime BP measurement were associated with greater risks of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurement for the estimating cardiovascular risks. For every 20 to 10 millimeter mercury of increment of blood pressure measured at night, the risks of mortality increased by 23%, and the risks of cardiovascular event by 36%. Most patients with hypertension require lifetime medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommended 5 classes of antihypertensive drugs. Considering high non-adherent treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommended, especially in the context to lower BP target, to start antihypertensive therapy with an initial dual fixed dose combination of SCE or ARB plus calcium channel blocker or diuretics. Since early July 2018, product containing valsartan, it is newer data from the valsartans. Since early July 2018, products containing valsartan have been recalled worldwide. The reasons is at the detection of a known carcinogens, namely in NDMA, nitrosodium methylamines, which can be found in candesartan, irbesartans, and losartan, olmesartan, and valsartans. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in human. If 1 lakh patient would be receive NDMA contaminated valsartan from the Jingwang basic manufacturers every day for 6 years, the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by the significant increase in rate of emergency department visit of plus 6%. The HITE study represented the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction of endpoint, including death. The HITE chronotherapy trial tested with a nighttime therapy in comparison to usual upon awakening hypertension therapy, exerted favorable cardiovascular risk reduction. The largest study included a total 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 particular participants experienced the primary CV outcomes, and ambulatory blood pressure measurement was performed for 48 hours to collect data on how BP differs during sleeps. The RR reductions for cardiovascular event was significantly improved for nighttime treatment when compared with the awakening treatment. So as a take-home message, most people with hypertension in India are unaware of their condition. To improve rate of detection of hypertension, all adults over the age of 18 should be undergo opportunistic screening for the hypertension during visit to non-physician health staffs as well as the health facilities. And addition, community-based health worker should also do target screening of high-risk group under their care: elderly, greater than 60 years, diabetic, obese, those who with any cardiovascular disease, and family history of premature CV death. So in nutshell, we should realize that hypertension is a primary care issue and best managed at the primary care level with a team approach involving physician and allied staff. Thank you.